Good afternoon, everyone, and thanks for joining us for a brand new Healthline 3. I'm Nate Fluharty, and over the next half an hour, we're going to be focusing on ways to live a healthier, happier, and a pain-free life, especially during these hot summer months. We're going to be taking your calls and answering your questions live here in studio today, and we'll be opening up those phone lines here in about 5 minutes from now, and I'll be giving you that number momentarily. But just a quick reminder, when you want to call, make sure you find yourself somewhere quiet so that we can hear you and you can hear us in turn. So make sure your TVs are turned all the way down or you are somewhere quiet. So that number to call will be 318-219-4569. And again, we'll be opening up those phone lines here in just a couple of minutes for this brand new Healthline 3. So with that being said, let's introduce today's featured guest, Dr. Gerry San Pedro from WIllis Knighton Red River Pulmonary Critical Care. Great to see you, Doc.
Thank you very much. Again, thank you for having me.
Yes, our pleasure. And, this is a very timely thing, and I think it impacts a lot of people. Things dealing with our lungs in the summer heat. We're going to be talking about some good stuff today.
Absolutely, absolutely. So the heat and the humidity affects not only people with lung disease and heart disease, but also ordinary people trying to exercise, trying to stay fit during the summer. Suddenly complain, well, I can't seem to exercise or run or do as much as I think I should be able to do.
Right.
And there really is a reason for that. Not just the heat, also the humidity.
So let's dive into that.
Yes.
A little bit ago, Joe Haynes was giving us that 7-day forecast.
Yes.
And I think that it's almost that time of year where we don't even need to see it. For those that have been here a while, you and I both included in that, we know what June, July, August, what it's going to be like. And for a lot of people, they struggle. And you mentioned both with some serious lung issues and both without. So let's get right down to it. Why does the heat impact our bodies, specifically our lungs, so much?
Of course. Well, we are built to function at a certain temperature, at a certain optimal temperature, and our bodies regulate us to that optimal temperature. So when we get to the 90s and 100s, that our bodies have to cool down. And to do that, our blood vessels actually open up to exude that heat out to the environment. Well, when the environment is already hot, we can't quite get rid of that heat.
Makes sense, yeah.
But that opening of those blood vessels also exert a certain stress or load to our circulatory system. So our hearts really are working a little bit harder in the heat to try to get rid of that heat.
I never thought about it like that.
When you have already a compromised cardiovascular system, well, that adds a little bit extra stress to that. And then the lungs also participate in that regulation. So we breathe a little more, a little harder to get rid of that heat. Sweating is, of course, our primary method of cooling down, but when it's already humid out and the air is already saturated with water vapor, that our sweat doesn't evaporate. So we stay sticky and wet through that this season of high humidity. We just can't get rid of it. So we stay hot and sticky in June, July, and August.
Yeah, I've never heard it explained like that before. It's almost kind of like, you got this vehicle, this car, and it's working harder just like our bodies do too when it comes to the extreme. I find it fascinating too that our lungs incorporated with that start working harder in the weather. It seems like the warm air would be easier to breathe than freezing cold weather, something like that. But
and actually the air, you've heard it said the air is heavier during the summer. Well, actually, in molecular terms, the humid air is lighter. Water vapor molecularly, the molecular weight of water vapor is less than, say, oxygen or nitrogen gas. But it's just the heat and so much water vapor in that air that we feel it to be heavier. We're working harder to move it. It's not that it's heavier, it's just more effort to move it.
I found the human body
Fascinating.
yes, it truly
Yes.
it actually is, and how much we understand, yet how much we don't.
Absolutely.
You understand a lot of it. So right now, let's open those phone lines, 318-219-4569. So who should call right now? Well, if you have lung issues and the heat's bothering you and you're wondering what you can do about it, let's get some answers for you. Let's talk about it. 318-219-4569. Doc, let's talk about some of the people that you help, some of your typical patients.
Yes. So we see a lot of people say with asthma. Typically we think of fall, spring as being the asthma seasons because of all the pollens and irritants in the air. But actually, summer is also a specific trigger season for people with asthma. For instance, ozone is an important trigger for people with asthma. We don't think of ozone here in the Arklatex, but it also happens. So that
now, if I may stop you right there.
Please.
And when you say ozone, I'm
Yes.
thinking about the ozone layer above our heads, 2
Yes.
miles of. How does that impact what we breathe right now? And what exactly is that?
So
if you're breaking
ozone is also generated. So we have lots of vehicles and trucks in our area. So they generate a lot of noxious gases from their exhaust. And then with the heat and the sunlight interacts with those with the pollutants and produce ozone. So ozone, to understand it, is actually 3 oxygen molecules combined together.
Of
And
not good stuff.
Not
sounds
very
like,
good stuff.
right.
Well, and then they settle down to now we have ground level ozone, not just out 2-3 miles in the air, but actually on ground level. And as the day progresses, more and more of that ozone is produced and more is present in the ground. That's why, it's much more difficult to exercise during the late afternoons when there's much more ozone, much more irritants in the air. So when we exercise, when people go out, we generally tell them, try to do it early in the morning when there's less irritants available in the air.
Let's talk about the workers that unfortunately cannot. The guys out there, the women out there cutting grass in kind of the roughest part of the day. The roofers out there, we think about the hot conditions with the sun, but with your lungs, you are bringing up an entire new realm of environmental contributors here.
Of course.
For these summer months. That's a big deal.
And basically that's why we see, it's a common joke, right? We see one person working and 3 others standing around. Well, those 3 others are recovering. They're trying to hydrate. They're resting. So they're taking turns. So that's basically what we tell our patients. Look, slow down, take your time. Take a lot of water breaks, of course. You have to hydrate. You have to replenish all that fluid that you lose from the sweating. And you take rest breaks to slow down and recover, catch your breath, let your body recover from all that effort.
For those that have to go out when they know that they may be dealing with some lung issues here and they think, well, I got to go to the store today, I got to go out in it.
Yes.
What are some ways that they might be able to prep themselves, their bodies? Is there a certain kind of, maybe not medication, we'll talk about meds later, but is it simply that, just prepping your lungs in the cold, or what can they do to get ready themselves?
It's a little bit of both, preparing. We've talked about hydration. We don't really realize how much fluid we lose just sweating and breathing hard. So when people tell me all the time, oh, I drink a lot. Well, but you're not aware of exactly how much fluid you're losing.
Right.
So drink more, especially when you're sweating during the peak of the summer.
Yeah.
And then other preventive things, yes, cool down, stop, have a fan going, get into cooler areas, into the shade, away from the sun, all of those things.
Kind of acknowledging that there may be a problem before there is one.
Absolutely.
So, wow, good advice here, Doc. All right, let's take it to the phone lines. We have our first caller here on Healthline 3. Mary, good afternoon. What's your question for Doc?
Afternoon. I have a question, kind of wanting to know the difference, responsive to the heat, kids as opposed to adults. So,
Yes.
how would kids, how do we need to handle kids' reaction, to the humidity and heat as opposed to adults?
That's a great question, and one we're not really, don't think quite as often about. Thank you very much for that question. Kids are very susceptible to the heat. They're not very aware. So as parents, we should be looking out for that. Water breaks, hydration, electrolyte replacement. We don't have to give them salt tablets anymore, but simply things like just regular foods to replenish their electrolytes that they lose through their sweating. But again, frequent breaks, lots of water, lots of rest.
All right, Mary.
Okay. Thank you so much, Doctor.
Thank you.
All right, give us a call right now, 318-219-4569. If maybe you're dealing with some lung issues right now, and whether it's contributed by the heat, the humidity, there are some things you definitely want to keep in mind, and that is today's topic with Dr. Gerry San Pedro from WIllis Knighton Red River Pulmonary Critical Care. And thanks for Mary for kicking things off with us. And let's get back to talking about some other issues like COPD,
Yes.
another very common issue for a lot of folks there. What exactly is that, Doc? If you would break that down for us, and how is that only going to get worse in the summer months for some folks?
So COPD, again, another common problem that we see in our practice, chronic obstructive pulmonary disease, COPD. A very common disease process. Unfortunately, in our area, we still have a lot of smokers, even though it is true, the rate of smoking is decreasing, but there's still quite a number of people in it. So it's estimated that there are 18 million Americans diagnosed with COPD, but a hidden number still undiagnosed. We see a lot of people who are surprised by the time they come to us and are suddenly diagnosed with COPD. Yes, smoking is still the number one cause of COPD, but there are lots of other people who have never smoked who still have it.
And we hear that with lung cancer and many other
Absolutely.
things too. So you don't always have to be a smoker, but it contributes. So back to, for those, what are some of the symptoms that people may have? It's kind of alarming for me to hear that so many folks may be living with it and not know they have it. So
a common thing that we hear is, I'm just getting older, right? I just can't do as much as I did when I was 20 or 30 years old. But that is partially true. As we all age, we all lose a little bit of lung function. But when the heat comes, when the humidity comes, and then suddenly you can't do, you can't mow your lawn when last year you were able to, or you can't barely walk to the mailbox to pick up the mail, then it's time to really think about coming in. See your primary doctor. A simple test, a simple blowing test can make that diagnosis and get started with treatment.
Is that with the little ball there?
There
I
you
remember
go.
that growing up. You would blow into that and you'd see things. Is that the easy test you're talking about?
Exactly.
Okay.
A simple blowing test, 10, 15 minutes to do, quickly makes that diagnosis. And we can get started. We can't get you back to normal, but we can at least alleviate some of the symptoms.
Yeah, fantastic. Wow, it's just amazing to me how many people could be out there and don't even know it. That's why, again, we so many segments we talk about the importance of seeing your primary and getting those simple year to year. So that's good stuff. All right, let's go back to the phone lines. Hot topic today, 318-219-4569. We have Denise on the line. Denise, what's your question for Dr. San Pedro?
And Dr. San Pedro,
Yes, ma'am.
I want to know I've been on oxygen for over 12 years now, and with the hot summers, it's just getting worse with the breathing, of course, the humidity and everything. You learn to deal with it. You learn to live with it. But I find myself using more emergency inhalers now, more than ever now during the heat of heat. Is that recommendable or?
So as we said, thank you very much for the question, by the way, and I'm sorry to hear about your troubles during the summer. It is true that as you heard me say, with the increasing heat and humidity, it's a little bit more work to breathe during the heat and the sticky summers. So a little bit of that is expected, yes. That's why we tell you to stay cool, stay inside, have fans going to help with the work of breathing. Be careful with those inhalers. There is such a thing as too much. If you're going through one rescue inhaler in less than a month, it's probably time to come in and talk to your doctor about that. We can adjust other medicines, adjust your settings, and try to help you with that work of breathing.
Thank you.
Thank you.
All right, Denise,
thank you for the call.
Thank you for the call. Yeah, 318-219-4569. Hearing from Denise right there. She mentioned, Doc, that she was on oxygen. A lot of people
Yes.
are. Do patients typically have to variate? Do they change what they take? Let's say for the spring months, it's summertime. Now we have to up a certain medication. Is that typical? Or, you alluded to that what Denise was dealing with is typical for a lot of people there.
It is, and folks find themselves having to use their inhalers a lot more often, but again with caution, because those medicines do have they have side effects. There is no medicine without any side effects, so we always have to caution you. More is not necessarily better. We try to get you to have some time in between doses for that rescue medicine for a reason. You can overdose those medicines and they become less potent, so they lose their potency after a while. So some adjustment is always necessary. For whatever your situation may be.
Let's talk about the difference. We often see some people outside running laps in this heat.
Yes.
Some people, you mentioned, can't walk to the mailbox. Is there a way that we can condition our bodies to get better in the heat, or is that a dangerous thing to do? If I'm wanting to get better out there cutting grass and I know doing it in August, I need to prepare now and do it now in this heat before it gets even worse. Is there a way to condition?
There is. We can. You already mentioned how wonderful the body is and how adaptable we really are. And for people with normal cardiovascular systems, pulmonary systems, yes, we can train our bodies. But up to a point, we really are. Even when we're world-class athletes, there is such a thing as too much.
Yeah.
So we do have our limits. For instance, again, very timely, the World Cup starts this week.
Sure.
And so these are world-class athletes. They run for 90 minutes, right? Nonstop for these games. But a fear is now they're coming to the United States in the heat and the humidity.
Saw that yesterday.
Yes,
Yeah.
and so we are, they're going through acclimatization drills. They're training in, down south. They're training in Alabama. They're training in Arizona in preparation for these heats. So if these world-class athletes have to adjust their routines, of course, you and I, our weekend warriors, we do have to make those adjustments also.
And that is certainly something to keep in mind too for our football coaches, our football players locally, just about any sport that's outdoors involving our young ones. This is the year when things really ramp up. We know it well in the Arklatex, but as Dr. San Pedro has been pointing out, just because we think we're used to it, certainly doesn't mean that we're immune from any sort of issue. I want to ask you about another issue too, Doc, that we hear quite some time is pulmonary fibrosis.
Yes.
Another issue that you tackle. Explain exactly what that is and how you're able to treat patients with that.
Pulmonary fibrosis is another worrisome condition where the lungs start to have a scarring process. The scars really are just like the scars in your skin, but this time scars are internal. And unlike asthma and COPD, where the problem is air movement and airflow, now it truly is, it's like being unable to blow up a balloon. We don't have the, quote, capacity to move air. The concerning thing about pulmonary fibrosis is many times we never find out what it is that causes that fibrosis. Once the scars are there, unfortunately, it's a permanent condition.
Your lungs don't heal like other parts of your body.
The lungs, unfortunately, once damage is done, we don't make new lung. That's it.
Let me stop you there, if you don't mind.
Of course.
So why, when we've seen the PSAs, I guess, of like a smoker's lung versus a healthy lung, that smoker's lung's always going to look that it's no going back. That's why we urge people to stop smoking.
So there's some recovery, but unfortunately not much. So we always say when you stop smoking, the immediate effects are to your heart and to your circulatory system. It takes a long time for those lungs to recover, and they never quite recover to normal. Again, the lungs, unlike the skin, we don't make new lung. That scarring, the damage is permanent.
Yeah, and that's why you are focused on preventative. Is so
prevention,
much in your
early diagnosis. So
that's great.
Don't wait until too much. People will say, "Oh, I'll keep putting it off." Right? I'm equally guilty of procrastination. Of course. I'll see the doctor when I have time.
Right.
And by the time you come to see us, maybe it's so far gone, it's too late. Yes, we can help, but early detection is even better.
Sir, I hear that from just about every doctor that sits in your seat. It's not, we as people, we're stubborn, myself included. So it's tough to do that, but that's why we want to do Healthline. That's why we're doing this segment, is so that we can answer your questions. Sometimes people are hesitant to go to the doctor. I understand, I really do, but that's why this gives you the chance to pick up the phone, give Dr. San Pedro a call, and get those answers. So here you are. So we got a couple more minutes, so we're going to leave the phone lines open, 318-219-4569 if you have a question, if you're dealing with some lung issues right now. But Dr. San Pedro, I can't let you go today without asking you about this. We talk about the dedication to our careers. The doc here actually made a pilgrimage to the guy that created the air conditioning, right?
Yes,
some variation. I got to hear this story. Give us this. Give us the lowdown.
So one of the benefits of modern life, of course, is air conditioning.
Yeah, we love it.
How can we live in a place like Shreveport, like New Orleans, in August when it's 90 degrees and dew points are 70 and 80%? Well, all that is the result of a work by a guy by the name of WIllis Carrier, very familiar name in air conditioning. So WIllis Carrier was a young engineer who was tasked with helping a printing company in Brooklyn, New York. During the summer, during these print runs, their papers would shrink and expand, in the heat and the humidity. And that would spoil their color printing process because they'd have to make several runs with the paper shrinking and changing size.
Sure.
So his solution was to cool the surroundings of the paper, not the paper itself, but the air around the paper by blowing air through cooling pipes and a condenser. And that was the origin of air conditioning.
They didn't have enough of it themselves, the heat. It was the newspapers
It was
that
the
finally
papers.
that finally pushed it back.
Yes.
All right, we got to
So
do something here. That's
He
pretty wild.
realized if I can do it in this limited space, I can do it with bigger condensers, bigger pipes in a room full. So that's how modern air conditioning was invented.
Fascinating.
He moved from Brooklyn. He moved his manufacturing facilities to Syracuse, New York. Property prices obviously were much less than there. And he built his home and his printing facilities there.
And probably
I
well
happened
air
to be,
conditioned, right?
Carrier air
imagine, yes.
conditioning,
Yeah.
absolutely. And I happened to be in a medical conference in Syracuse, New York, and on my trip back to the airport, I asked my Uber driver to stop
Swing by.
in this little place, and he kept asking me, "Why are we stopping in this residential place?" I guess, well, this is the home of WIllis Carrier,
Yeah.
and we could not live in Shreveport, Louisiana, without his invention.
I couldn't. I know people did hundreds of years ago, but you know, it is fascinating because you know, a week doesn't go by where I'm not talking to one of our meteorologists about the
Yes.
heat and thinking to myself, how did people do it before air
Amazing.
conditioning? How did they live in the Arklatex and, you know, ride horses everywhere and wear long pants every single day?
Wool. They
Yeah,
wore wool.
but it was thanks
in
to
the summer.
Mr. Carrier there for that. So pretty fascinating. Well, Doc, we got just about 3 minutes left. Steering it back to today's topic, it really has been an enlightening one. I've learned a lot. When it comes to our lungs, how they're impacted in the heat and humidity. But for those that may now just be joining us maybe a couple minutes late, give us a recap on your typical patient. For those that are out there maybe have some lung issues, how do you help people out? Can they reach out to you and your team, or?
Absolutely. So, but we always tell folks during the summer, just acknowledge it, right? Acknowledge that these next few months we're going to be working harder. Our lungs, our hearts are going to be working harder to deal with the heat and the humidity. So yes, hydration. We're hard-headed. We put things off, but frequent breaks, frequent hydration, drink a lot of water during the heat of the summer. I already alluded to work breaks. Stop. You don't have to finish the entire yard all at once. You can take half of it, take a few minutes, take a few swigs of water, and then go back to it.
And one thing too that I think has been very important is listening to your body when it comes to the early warning signs. I know that I'm one I can push through. I can power through this is what I frequently tell myself. But as you alluded to today, that could make things a lot worse.
Absolutely, absolutely. It's better to acknowledge that it's going to take a little bit more time to finish our yard work, our gardening, to finish that exercise routine. So just listen to your body, listen to the clues that your body's trying to give you.
Absolutely, that's why they're there for a reason. But if you are having some issues, if you're having some problems with those lungs, he's the man to call. Great team behind him there at WIllis Knighton Red River Pulmonary Critical Care, Dr. Gerry San Pedro. Well, sir, thank you very much for being here. This is a very great and enlightening Health Line 3.
Thank you very much for having me.
All righty, and remember to stay tuned. We're going to hopefully have Dr. Gerry back on very soon to get you through these summer months. But the heat and humidity keep you safe, sound, and cool as much as we possibly can. That was another great Health Line 3. Remember to stay tuned for more in the future, and always by going to ktbs.com. Keep it happy and healthy, everyone.